of them have been locums, so they've been here for short periods of time. They've had trouble finding permanent people willing to take on permanent posts, and because we're working with them remotely usually, that most of them are based at the outpatients department in St John's Hospital, so not always easy to get hold of. And I suppose some of it can be personalities as well, but I think it's just the traditional sort of NHS hierarchy, which is not always a pleasant thing to work in when you're a nurse, and maybe there's a perception that I don't know, maybe nurses feel they're not listened to. So yeah, I suppose, but that's an old story in nursing, I think. Okay.
And during this period, what kind of support did you receive?
I've got really good bosses. I'm actually the junior nurse. It's a small unit. I'm a band 5, there's a band 6, and then there's a band 7. Yeah. Well, there's also a band 3 as well, but in terms of the registered nursing, I'm the junior member. And they're both very supportive. If I need time off to go to, on the newly qualified training program, if I need time off for that, it's not a problem. If I need time off for other stuff or to shift my caseload around, as long as everything's covered, they're happy. You know, if I work late one day, they don't mind if I come in a bit late the next day. They never ask any questions like that. It feels like they've got a very mature perspective on the job, and they know very well if someone isn't pulling their weight or serving the needs of the patient group, and when they know someone is looking after the patients as well as they can, then they're very supportive. You know, if I need to take time off and need some of my work covered, they'll do it, and equally I'll do that for them as well. So we look after each other in that way. We cover for each other. When someone has a particularly difficult day and they need a favour, we always try to squeeze it in, you know, to support each other.
Okay. So now that you have been working as a qualified nurse for some time now, do you think there's a difference of an experience now in the work environment now as compared to when you started it?
In terms of, like, from when I first started as a registered nurse, yeah, I suppose confidence. I'm growing in confidence. Do you mean in my own perspective or in terms of the actual job?
Both.
Well, in terms of my own perspective, there's a slowly growing confidence in terms of contacting different professionals and pushing for things as well. You know, for one particular patient, I've had to push the social worker who works with this patient to get some serious changes to the care package, because I had more contact with that patient and had concerns. So I'm happy to be pushier now, or I'm always as polite as I can be when I'm doing it. But I suppose that's about growing confidence and settling into my job role and feeling that as a CPN, okay. I don't know other professionals how they view nursing necessarily, but as a CPN, I feel that I can speak reasonably well on behalf of the patients that I know, because I have a lot of contact time with them, and I think I can speak with some authority in terms of their issues that they face. So there's a growing confidence in terms of the job itself. It's difficult. I think the nursing roles will be, well, I know that the senior nursing jobs, a lot of them are coming up for retiral in the next year and a half. So the band 7s will be retiring, and hardly any of them will be replaced. The band 6s will be thinned out as well. So there'll be a lot more band 5s. There'll be a band 6 coordinating, and then a band 7, maybe one band 7 sitting over several community services. So that looking ahead, it seems like the prospects for promotion are probably quite slim, I suppose, and that's been emerging over the last few months in terms of how the service is dealing with budget constraints.
So I'm sorry, you mentioned earlier CPM. Was that it, or did I hear it wrong?
Did I mention what? Sorry.